everyone, my name is Layne and for my transcultural nursing presentation, I would like to talk to you about the Native American people. Only 1.4% of North America's population identify as Native American. Due to these small numbers and isolation from Western culture, Native Americans remain poorly represented in American medicine. Many Native Americans lack access to modern medicine, often due to poor access to transportation, living in isolation on reservations, few available healthcare providers, and a general mistrust of Western culture. Sadly, this is only worsened due to 1/3 of the Native American people living below the poverty level. Native Americans live with an increased risk for multiple medical problems such as alcoholism, cirrhosis, type 2 diabetes, cardiovascular disease, renal impairment, and gallbladder disease. Social and psychiatric problems are also of great concern, with domestic violence, depression, and suicide often plaguing the Native Americans. Due to all of the health risks that these patients carry, it is imperative for healthcare personnel to provide culturally competent care so we can better reach this small but diverse population. Native Americans trace their ancestry back to the original people who inhabited the Americas. A commonly accepted theory is that the Native Americans migrated across a small land bridge between Siberia and Alaska between 17,000 and 34,000 years ago, way before Columbus was even born. A little over 500 years ago, the majority of America was inhabited by these indigenous people. However, after the discovery of the Americas by European settlers, Native American numbers dwindled. Native Americans, American Indians, and Alaska Natives all represent the last 4.1 million people who identify as the first who discovered America. There are currently 500 nationally recognized tribes. However, due to their few numbers, they are currently one of the smallest minorities as well. An important point to make is that no tribe is exactly the same. There may be similarities in beliefs and cultures between tribes, but every tribe has a unique set of beliefs. Native Americans are often plagued by historical trauma. After the arrival of European settlers, the Native Americans were nearly wiped out. The arrival of European settlers meant the introduction of diseases, genocide, and warfare to the Native Americans, nearly causing their extinction. Due to this dark mark on American history, many Native Americans have difficulty trusting Western culture. Many choose to stay close to reservations, which often leads to isolation and poor access to health care. Although no tribe is exactly alike, many Native Americans practice a belief in a Great Spirit, a being that exists all around us and embodies life itself. Some traditional Native Americans practice prayer for harmony with nature. Their prayer is often for the benefit of others too. Many Native Americans choose to live on reservations, isolated from Western culture. Family remains a great part of Native American culture, often including an entire tribe. It is not strange for over 100 Native Americans to visit a friend or relative in the hospital. A strong sense of community and cooperation are ingrained in the culture. Reliance on extended family is common, and it is very important to put the needs of the tribe and other people before your own needs. Native Americans are often very welcoming of helpful suggestions or advice, but do not appreciate beliefs or ideas to be pushed on them. An important thing for many people to understand is that there are physical and spiritual differences between each tribe. Also, some may identify as Christian, some will maintain their traditional beliefs, and some may utilize both. It's important to keep an open mind. Medicine men are often utilized by traditional Native Americans instead of modern medicine. Much like Western doctors, healers will diagnose a patient and either treat the illness or refer them to someone who specializes in their illness. It is not uncommon for a medicine man or a healer to visit a patient in a hospital. Please be mindful of this. Often healers will use song, meditation, chanting, or beating drums to identify the illness or call back a person's spirit so that they may be healed. Repelling evil spirits is something that you might encounter in a hospital room with a Native American patient. The medicine man may burn or sprinkle crumpled sage around the patient's bed. Medicine bags filled with medicinal items may be given to hospitalized patients. It is important to allow for the bag to be with the patient at all times. This includes putting it in a sterile bag and keeping it with the patient during a surgery. Always allow for medicine men or healers to be with their patients. You are less likely to establish trust if their traditions are not honored. Childbearing typically involves all women in a Native American family. It is considered matriarchal, with daughters, mothers, grandmothers, aunts, and extended family being involved. Tribe elders were often sought out for advice for the act of childbearing. Proper nutrition for Native American mothers and their babies who are breastfeeding is important to help prevent childhood obesity in the future. Try to teach mothers and their families how to get adequate nutrition using traditional Native American food choices. Breastfeeding mothers are often working several jobs to provide for their families. Talk to your patients about using breast pumps to store milk while they are away. Children and teens are at increased risk for teen pregnancy, fetal alcohol syndrome, depression, and suicide. Teens are more likely to contract an STD such as HIV and hepatitis C on Native American reservations, mostly due to a lack of education. Education regarding safe sex practices and suicide prevention programs are imperative. Young Native Americans may not trust education given by Western healthcare workers. One way for us to gain their trust is to use a talking circle, which is often utilized by Cherokee culture. A talking circle is a place of respect and acceptance where Native Americans can come together and share stories or advice. When caring for Native Americans, specifically adults, be respectful of patients utilizing traditional spiritual practices in their healthcare. Always ask, are there any spiritual practices or concerns that we can assist you with? If a medicine man is present, allow for safe rituals and ceremonies to be performed. Do not deny a Native American from being allowed to have their medicine man in the room with them. Avoid eye contact, which may be considered rude, and avoid speaking in a loud voice. When speaking to an adult Native American, always speak in a quiet, direct manner. It is not polite for a listener to indicate they do not understand. Never use words such as huh or excuse me. Be mindful of your choice of words. Stating a test result was positive may be misunderstood to be a good diagnosis. Personal space is important to the Native American people. Avoid touch unless you seriously know the person. Many Native Americans will be stoic in expressing pain. It is important to not rule out that they might not be in pain because they're simply not expressing it. Check vital signs and other important measures of checking pain. Avoid stereotyping. All tribes are different and practice different traditions and beliefs. Some Native Americans might not identify at all with their culture and may be entirely westernized. Once trust is established, allow for education such as proper diet and exercise, avoidance of alcohol, and depression and suicide screenings. A great emphasis is often placed on respect for elders and heeding their advice. Often, the elders will be in charge of the tribe. Elderly Native Americans may be less likely to change their health practices, but modifications can be made. For example, you can change their diet not by simply changing their food, but perhaps changing the way that they cook it. Women typically act as the caregivers in Native American society. Generally, 1 to 2 females will often be designated as caregivers for an aging tribe member. In the event of death of the elderly, 1 to 2 tribe members, typically female, will perform post-mortem care. It is important that we allow for this and not have hospital personnel perform the post-mortem care if that is not what the Native American family wants. It is understood that the body must make a journey to the afterlife and therefore must be properly prepared. The deceased must be washed, have certain items for the journey placed with the body, and the body must be arranged in a certain cultural position. Allow for family members to handle the body whenever possible. Do not force Western traditional postmortem care upon Native Americans. A Native American community generally involves an entire tribe. Extended families should be involved in healthcare, including aunts, uncles, grandparents, cousins, and friends. Considering that elderly members of the Native American community are often respected and sought out for advice, it is important to try to consult with them first when trying to reach an entire community. As stated before, encouraging the discussion of healthy lifestyle choices during community gatherings such as the talking circle would be very beneficial. In conclusion, Native Americans are family and community-oriented people, often not traveling far from their tribe or reservation for most of their lifespan. Promoting health care for the Native American people remains a challenge in modern medicine. Due to a long history of damaging relations with America's indigenous people, establishing trust continues to present as a problem in providing health care. By expanding cultural competence, healthcare personnel can hopefully reach out to members of the Native American community, gain their trust, and help provide them with the appropriate health care that they deserve. Thank you so much for watching, everybody. Merry Christmas.